Aquastretch, innovation in movement. Team members are Nisharag, Shah, Christina, Smithson, Dallin, Yarrington. They're second-year physical therapy students. Dr. John Heck, their faculty mentor, is not with us tonight, but here in spirit. You're on. You got 10 minutes to make the pitch.
Hi, my name is Nisharag Shah. I'm a second year once again.
Hi, my name is Christina Smithson. I'm also a second year PT student.
And I'm Dallin, Yarrington.
So we're Aquastretch, Innovation and Movement. Aquastretch is an innovative new therapeutic technique in the water, and we want to bring aquatic therapy to AT Still University.
So 2.5 hours. How many of you have ever played a sport or watched a sport before in your life? So I think that's most of us, right? Imagine I came to you with a sport that you had never played before, told you about it, gave you 2.5 hours to practice, to train. Do you think that you'd be game ready at the end of 2.5 hours? What do you think? You think you would?
No.
You're unique.
No.
Game lousy.
No.
No, I don't think most of us would be. Here at AT Still, we have 2.5 hours in our curriculum dedicated to aquatic therapy. Many of us at the end of our time here at school will be going on to work in clinics where we will be treating patients utilizing aquatic therapy. And we feel that that is probably not enough time for us to be game ready when it comes time. And so we would like to enhance the opportunity for us to, as students, to be able to get aquatic therapy. And we'd like to do that through a technique called Aquastretch. So over the past couple of years, several of us students have been going out to Lake Havasu City and getting trained on a technique called Aquastretch. We've been using our own time, our own resources, and doing this outside of the curriculum so that we can enhance research and also treat our patients better. So you may be asking yourself, what exactly is Aquastretch? Aquastretch is a myofascial release technique that is performed in the water. It is also performed actively. And so it is similar to other myofascial release techniques in that it tries to break up myofascial adhesions. Myofascial adhesions are something that occur commonly in the medical world. We know about them, and they can cause problems in movement, can cause decreased range of motion, increased pain, decreased function. And Aquastretch is specifically targeted to try and break up those myofascial adhesions. Myofascial release techniques on land typically tend to be taxing on therapists' hands, which we consider to be our livelihood, and can take a lot of time. Aquastretch is unique in that it can be worked a lot quicker, and you can actually treat the whole body in 20 minutes, and it's a lot less taxing on us therapists.
So imagine yourselves with a certain condition such as fibromyalgia or any other condition where you're living constantly and you have chronic pain all day, every day. It's affecting your activities of daily living, and you're unable to just be happy and live your life pain-free. Doesn't sound very fun, does it? So Aquastretch actually has been shown to relieve that pain, to increase functioning, improve range of motion, and just basically help people to live a healthier and happier life. So you're kind of probably all wondering why we have bowls of water up here. So we have a set of 3. If we could have like 3 or 4 of you judges kind of come up if you would like to. You don't have to if you don't want to. We didn't have enough room to set up for all of you, but if you all want to come up, you can at some point in time. And so there's a bowl of cold and a bowl of just go ahead and, stand wherever you want. There's one bowl of kind of cold, normal pool temperature water, and then there's one bowl of therapeutic ranged water, which is about between 89 to 92 degrees. And what I want you guys to do is just stick one hand in the cold water and one hand in the warm water. And if you don't mind, our PT students are going to be kind of like moving your hands. I want you guys to move your hands freely, move all the joints and muscles in those hands. And just think about how you feel with the cold water versus the therapeutic ranged water. Does one feel more restricted than the other? Does one feel more relaxing than the other? And I want you guys to imagine your entire body submerged in both types of waters, and just kind of imagine getting therapeutic exercises done in each type of water. And you guys can go have a seat if you want. So my question to you is, which one would you prefer to have your entire body submerged in? Which would you feel more relaxed in? The warm?
88 degrees.
Yes, yeah. We had it at temperature right before we came out. So, so basically, if you all said the warm water, we as Aquastretch students would completely agree with you. The temperatures of 88, 89 to 92 degrees are known to help relieve pain and tension in the body. It's supposed to help our patients move more freely, which is the point of Aquastretch. We want them to move their body so we can work the adhesions out. It is also able to do that through increasing peripheral or the circulation in your body and decreasing blood pressure. So it's very, very crucial to have that therapeutic range while working with our patients. What I wanted to say is we've all, as Dallin said, been traveling to Havasu to get training. And we're currently working on our IRB to start working with CrossFit athletes who we've also seen in Havasu. And we've spoke with about 8 CrossFit gyms just who are interested in working with us to get Aquastretch done to people with upper and lower extremity injuries or pain. So, however, we have not solidified yet a therapeutic pool due to funding. So we're still kind of working on that right now. And as you can see, it's kind of crucial to have that. Our goals here are to just increase the research because there's very limited research, as well as to be able to practice this and get better at our techniques, and to open it up to AT still as intercollaborative technique.
Yep. And so a lot of those points that Christina mentioned, I'm going to spend some time on them. So our budget handles interprofessional collaboration. It allows us to not just, we're physical therapy students learning the technique, but occupational therapy students, athletic trainers, they spend some time in the water too. And I'm not familiar with their curriculum, but they're spending time in the water, and they'll be around clinics in the future that has aquatic therapy involved. And so our budget doesn't only focus on the current research that we're going to perform and our current treatment, but it's also going to focus on the future and opening it up to future students at AT Still University and allowing them to experience aquatic therapy and Aquastretch as well. And we have an instructor in Lake Havasu City who is willing to teach all of us and spend some time at our university. She's a prior alumni at our university. She graduated from our physical therapy program, and she's also the vice president of the aquatic therapy section for the American Physical Therapy Association. So she's very excited for it. And so we are also involved in this. And so we want to help the students learn the technique amongst us and our future classmates. And finally, this budget is going to make a difference in advancing the literature. If you think about manual therapy and physical therapy, there isn't that much research that solidifies its use and value. And now aquatic therapy, if you go online and if you look over various journal articles, there isn't that much research on it. And our goal is to make a difference and make an impact on advancing the literature. And we pick CrossFit athletes because they're highly motivated. However, one of the studies that we've come across and we've noticed is that their most prevalent pain is low back, the hip, and the knee and shoulders. And so obviously that's a whole body. And Aquastretch, in one treatment in 20 minutes, we can go from the toes to your head and interact with all the connective tissue in that moment and help treat those impairments. And so I want to end with this slide. Dr. Tayan is a colonel in the U.S. military. This past weekend we went to Anaheim at the American Physical Therapy Association a combined sections meeting. And over there, she mentioned this image to us. And I think that's very important for our goal, is if you're a patient that has, you have to utilize a wheelchair throughout your day, if you're, experiencing pain, or if you're an athlete that's experiencing pain, some sort of your life in this circle will be affected, whether it's spiritual, whether it's emotional, whether it's your surroundings, or your family life. And so with Aquastretch, we're going to be able to help our patients think about their whole person healthcare and also improve their overall outcome. And just imagine yourself with the pain that you have, that you may be experiencing if you're in a warm therapeutic pool, and how much a difference a good stretch would make for you. Thank you.
Thank you.
Thank you. What a wonderful person. Great job. Great job. Any questions from the judges, please? Yes, Sean.
Is there any, you demonstrated one temperature. Is there any work in this area where you use, let's say, a gradient of 3 different temperatures to, let's say, unlock a joint or anything like that?
There's been some studies. I was reading a study on the Aquatic Therapy Institute, American Aquatic Therapy Institute, and they tested different temperatures, higher and lower. They said that the higher temperatures, it's hard on people with like diabetes and cardiovascular issues. And they also worked with the lower temperatures, such as we did, and they found that they were contracted. They didn't have the relaxation, such as the 89 to 92 degrees.
Great.
Thank you.
Michael.
Have you been discussing with the PT faculty if they would, getting the 4 of you training would be good, but how this can impact the curriculum and how it can be worked in future years? And do you know also if other physical therapy programs are doing more in this sort of training than we are?
There are some programs that are. I can't exactly answer that question, but the one thing is that in our curriculum, we don't have time to incorporate aquatic therapy for a longer period of time because of APTA requirements for curriculum and graduation requirements. And the main thing is there's limited research in it. So our curriculum is not going to invest a lot of time in putting in things that have limited research when we have a lot of other things to learn from. And so each year in our program, there is actually like 4 to 5 students that learn aquatic therapy that are interested. And this option will allow us to open it up at our university more. And because what we're suggesting is the instructor that's in Lake Havasu City, she says she's willing to come out here and spend her time in teaching us the aquatic therapy technique if we're able to get a pool.
Great. Thank you. Okay, Beth.
Yeah.
One question.
I'm bummed that I don't meet the qualifications for the research study, so unfortunately, but I'm definitely a future standardized patient if you get this into the curriculum. This was awesome.
When we practice, we need patience. And we always practice hands-on.
You know where
There
our
you go.
office
If
is?
you need an old lady, I'm there for you.
I love it. Let's give it up.
But my question is, with this added to the curriculum, does this make you more employable upon graduation?
Yes. Because you want to answer? All right. So it does, because at the end of it, we're not just PT, DPT, but we're also Aquastretch trained and aquatic therapy. And there's a certification test we do take. It's not officially recognized by APTA yet, but it is going to, hopefully will be in the future. But we do say that we're Aquastretch trained in our resume. So it makes it a better selling point for us.
Also, with our patients who aren't able and don't enjoy land-based techniques, we would be able to put them in the pool, so they would benefit from that. So we're thinking from a patient perspective, we're trying to help our patients out. So yes, we would be.
Very cool. Norm?
I'm just surprised you didn't refer to those 6 bowls as spark tanks.
There you go. Very good. Thank you very much. See, there's something to be said for Brooklyn in spite of everything. I know. Let's give it up, please.
Thank you, guys.
Nisharag, Christina, and Dallin, thank you very much. Well done. Great job.